Go.
All right, so I think we're ready. Yes, we're ready, and it looks like the speakers are working. All right, welcome. This is the Wake County Libertarian Party, our Wednesday meetup. Most important stuff first. Early voting starts tomorrow, which means if you live in Congressional District 4 and you are a Libertarian or unaffiliated, you will go tomorrow or Friday and vote for Barbara. You don't even need to wait until the primary on 8 May. So, and because not everybody is here tonight, bring an unaffiliated friend, and if you can, we have stuff after this where we can sign you up for canvassing. We can hook you up with some door hangers and little Barbara Howe pamphlets and what have you. So please get the word out. We definitely want her to win her primary. Our charity event is this Saturday. It's an easy one. It's about a 2.5 mile walk for ALS. You can go online and look for Party People or our own Facebook page, and that meets Saturday morning. I think it's like 9 or 9:30. People start showing up. It's Halifax, small area, 300 block, the nice grassy field. You'll see signs. This may take a little while. Sorry, it's a real quick sheet. I'm going to try to work through it. Next week, we will not be here. Does everyone know that? We will not be here. You have access to Facebook. Little Pink Houses is the story about, eminent domain up in Connecticut and the Caleb decision. So that'll be the Cinemark at the Raleigh Grand. So we will all be at that movie, I hope. And some of us will meet at Linwood Brewing Concern up in that area off of Barton Road before there around 6 o'clock. So is there anyone who doesn't have a ticket for that, who also lives in CD4? You do, actually. All right, hold on. Now you have a free ticket, and now you have to vote for Barbara, who's sitting right in front of you. All right, other things, Travis Drew has a kickoff event on Saturday, the 28th of April. That's at Fort Knight and Cary. Jeff Matemu has one at Brentwood Park. That's between Atlantic and Capitol in North Raleigh. And for May, Passage Home, where Owen is on the board, they have a fish fry charity event. And then the last one I'm going to go over is 12 May. If you are a candidate, Americans for Prosperity and Liberty on the Rocks has a training event for us. That'll be at Tally Student Union at NC State from 10 a.m. to 3 p.m. on Saturday, May 12th. Any questions about any of the events coming up?
If we vote early, can we vote on May 8th again?
Sure. You try that. Let me know how that goes for you. And then Steve Prince will have to step up and we'll just deal with voter fraud some other time. So anyway, don't do that. Anyway, we're going to get to our speaker event for the evening. I appreciate everybody coming out. It's Dr. Grewal will be talking about direct primary care, the 2 branches of her practice, and talking to her. She has a lot of interesting experience in a variety of locations, so she should have some interesting perspectives on healthcare. So, Dr. Grewal.
Thank you. I'm Dr. Grewal. I am practicing here in North Carolina. It's not loud. Hi.
Hello.
I guess you can hear me now. I'm Dr. Grewal. I practice in Cary, North Carolina. I was born in India and raised in Durham, North Carolina. From very early on, I knew I wanted to be a physician. And the way I envisioned medicine as a growing child in India was very different to the way I practice medicine in modern America. I started my career at Duke. I started working as a research analyst at Duke Alzheimer's Disease Research Center. And I was very, very interested in neurology. And I matched at Loyola Medical Center for a 4-year categorical program to do neuro. And decided to leave that program because my husband was at Chapel Hill doing his residency. The long distance just wasn't cutting it. So I matched in primary care. I was really upset about that because I had to leave neuro, but I was actually so glad that I did because now I can do so much more with primary care than with neuro only. Right after residency, I worked in private practice in Columbus, Georgia, where I was seeing 16 patients in 4 hours, and sometimes up to 32 patients in one day. So basically, in those 4 hours, if you have 16 patients, you are literally going in your brain, all right, let me listen for the buzzwords, and what are the different things that I can order for this patient? What's the prescription that I can send for this patient? I mean, that's all the time you possibly have in those few minutes. Well, a year later, we moved to Fayetteville, North Carolina, and I got an opportunity working in an academic center, and I was really happy about that. I said, well, maybe it wasn't, private setting wasn't for me, maybe I just need to go in teaching in academics. It wasn't ideal because even though it was patient-centered medical home, and I trained in that program, I still felt the overall health of the patients was nearly the same, even though they had gotten a designation with patient-centered medical home. I was still doing the same thing that I did as a resident there. So I decided to take some time off and thought maybe I need to do a little bit of soul searching, figure out what is it that I really want to do? What kind of doctor do I want to be? I started looking into direct primary care, and it was very attractive to me for many reasons. One, it was affordable. Two, was that I could spend a lot more time with my patients and actually get to know them and form a relationship-based practice. So what is direct primary care? So it's basically a very innovative, simple form of primary care, which involves a membership-based structure. You pay a recurring fee to your primary care physician, and we do not bill a pay-per-visit. So there's no co-pays, no deductibles. You can see your PCP as many times as you need to. And it really eliminates, for me, bringing a patient into the office versus my whole goal changes with the patients, that I want my patients to be out in the community, healthy and vibrant, and becoming their vital community members, instead of spending time in my office, because by bringing them to my office, I have no incentive to bring them in. So be it televisit, be a phone call, be a text, those are all different ways that I communicate with my patients. And it doesn't change anything. The fee stays the same per month. Recently, I think there's been a lot more media attention that direct primary care has gotten over anything else. Forbes calls it the low-hanging fruit in healthcare. Time magazine says medicine is about to get personal, and I do agree with that. It's a very personal form of medicine. Direct primary care may become the norm. This is medical economics. So, but there's been a lot of negative PR also for direct primary care. There was a big Dpc practice in West Coast that was shut down because apparently Amazon started getting into it.
Classic, please. Cheddar and lettuce and tomato.
So some of the Dpc characteristics that you'll find in most of the practices is there's transparent pricing. There's no hidden fees. We contract out our labs and radiology and prescription drugs. So if I have a patient that's on, let's say Adderall, or they need an X-ray, I can tell them how much it's going to cost. Or I have a list of pricing, or I can call different providers and say, hey, I don't have this, but I need this rate. So we do price shopping for our patients. There's freedom to choose. A lot of patients decide to decline certain forms of treatments, and we, I think, are pretty lenient when it comes to choosing what kind of therapy is right for a given warrior. Patient privacy, we do follow privacy. We don't report anything to any agencies about your health. There's no outside interference. So if you need a CAT scan or an MRI, that'll be between me and you. And we decide, and I can get a cash rate, which is going to be cheaper than going through your health insurance. It's affordable, and the biggest thing is this relationship-based care. When you have a relationship with your doctor, those patients tend to be a lot healthier. They tend to listen to their physicians a little bit more than if you just go in and you're going to the doctor just to get an antibiotic. Some of the new millennials, that's all their relationship is, because they know this is what's wrong with me, and I'm just going to go get a prescription from my doctor. And we welcome all patients. And DPC has, any socioeconomics. So how do we make it work? That's a big question that a lot of doctors ask us. We actually do not have any overhead costs. I have an office, but I don't have any front desk. I don't have any receptionist. I was answering my own phone calls up until a month ago that I hired a virtual assistant. She answers my phone calls now. We don't have any billing staff. There's no insurance billing, so I don't need any staff to bill anything. Typically in a DPC practice, there's a doctor and an RN. They kind of do everything. And my office is doctor and an admin. So I do everything basically. So why are these patients healthier? In my terms, and I could be biased, but I think in a year, my patients have lost over 700 pounds. Because I spend time listening to them. I spend time listening to their stories. We form relationships. And once I talk about my functional medicine part, and that is all but a patient's story. So when they are able to form this connected relationship-based care with the physician, actually their health starts to improve. And they do get motivated to lose the weight or change the food or do stress reduction, do meditation, those kinds of things. They do have an access to the doctor via their cell phone. They can text me anytime, which I think it also, and the most surprising part is most of my patients do not text me. Because once they know they have this access, there's no urge for them to keep seeking me out. They know that they can text me anytime. So most doctors think I probably must be very busy texting my patients. They never bother me. Like I said, if it's on a weekend or I'm traveling or they're traveling, I will hop on the televisit. So basically, my laptop, I can see a patient right now. I have everything on my laptop, my fax, my EMR, my scheduler. It's a very high-tech and high-touch practice. This is some of the features from my practice. We take time to make relationships with our patients. So most of the DPC doctors, any doctor that is into this form of care, because they're burned out. Physician suicide and physician burnout rate are at epidemics right now. We focus mostly on prevention, stress reduction, nutrition, movement, and your personal relationships, which are the 5 pillars of health. I think I follow the Pareto's principle when it comes to prescription drugs, and I use them 20% of the times, 80% of the times it's lifestyle. The other thing that I use which benefits a lot to my patients is something called Heart Map. And Heart Map is a software that, so traditionally we used to think that heart is just a pump. And all it does is basically circulates our body with blood, or perfuses our body with blood. But it turns out that HeartMath Institution has done 20 years of research that heart has its own emotional regulation center. And what this does is our brain is more linear and our heart is more emotional. And now it turns out that I can teach patients emotional regulation using this heart map. And I have it with me if somebody wants to try it. And it can really, they can see their heart rate variability. So from time to time, how our heart rate changes as emotions are flooded in. And if we just change the way we breathe, we can change our heart rate. And you can see that in real time if somebody wants to try that. And in studies, and they've done studies on employees at NASA, and other big companies, shows that, you know, it does have significant reduction in arrhythmias, insomnia, fatigue, anxiety, tension, GI issues, body aches, pains. A lot of it is actually chronic stress induced. So yeah, if, for more information, you can visit the website or call the office. Olivia is the VA that she can help or.
Thank you. As usual, we're going to go into Q&A, and I'll give you the microphone. Gentle reminder, Q&A is not for diagnosis right now. Stories about what was wrong with you 3 years ago. Please ask a question when you ask a question.
I'm a patient with Dr. Brett.
Okay, Brian Forrest. No, Amy Walsh.
Amy Walsh, Dr. Amy Walsh, and it's fantastic.
Yeah.
But one of the interesting things when I talk to friends and neighbors about signing up and doing it, the first thing they seem to get upset about is, what do you mean they don't get any insurance? And I keep saying, but it's worth it. I really want to talk to my doctor anytime I want that.
Doctor, I had a question. Do you do a lot in homeopathic treatments with your patients?
I do not, but I do a lot of herbals. I do practice functional medicine, which is the other part of the practice that I didn't talk about, and I can keep that on. Keep it on, okay. Yeah. So the second part of my practice, which is called functional medicine, it's very unique in that sense that in functional medicine, we don't look at a symptom. We look at a system. So basically, from the patient's timeline, we craft out different systems that are off. So you don't really have a diagnosis that we can pick up on Western medicine, but we have an imbalance. So the Eastern philosophies believe that we have stages of disease initiation, progression, and by the time it gets diagnosis. So in the Indian Ayurveda, there's 6 phases and stages. So the very first initial phase is just an imbalance. So in functional medicine, we can pick up those imbalances and we can fix them before they become a disease or a problem. So that's where that's where you can use herbals or homeopathy and a lot of the Eastern philosophies because things are not that broken yet. But if you do just keep on with the way you're living and you are phase 6 and you've developed diabetes, cancer, yeah, there's little we can do even at that point, but unfortunately, that's out of the bag by then, so.
I have 2 questions. My first question is, if a patient needs some more intensive specialist, what happens?
So you have to either use your insurance for that, or we do make special rates, cash rates, for people who do not have insurance. And some of the DPC doctors use an online software called Rubicon MD. And Rubicon MD has all kinds of specialty care consults available, but you are the doctor who's going to be implementing the program under that specialist guidance.
And my other question is much broader. Do you see any way that this sort of practice could be expanded? And maybe it's already, first of all, maybe it's already used in specialists, but it could be expanded to like a Medicaid population, Medicare.
Actually, actually just New Jersey just signed their Medicaid population to a DPC practice. And I believe Washington State also did that. North Carolina, I think there is one county, and I can't think of that county, Union, yes, they did that, thank you. Where they noticed that a lot of their employees were actually a lot healthier than their previous.
There's substantial cost savings.
Yes.
The county saved about $1 million, I think. So patients happier, county saves money.
How about I'm sorry, I'm monopolized. How about any kind of electronic medical records? What if someone has to go to another physician?
Yeah, I use electronic medical records. And you have access to them through patient portal.
Right.
Yeah.
One last question. Have you ever thought of, or not you personally, but as a group, thought of or have been approached for something like state Medicaid? As there are various options and care.
Not for that, but I've been approached to work with New Health. New Health is spelled with KNEW. What they're doing is they're contacting employers in different states, and they're looking for functional integrative DPC doctors to join the team because, and they're actually, what they're going to do is they're going to actually, we're not going to build the insurance, but they have a special insurance product that's going to go be billed somehow, but we're still going to stay DPC. And they're going to be using this for special employees or their companies to target autoimmune problems, basically. Because in functional integrative medicine, we can do a lot more than solutions.
So, has the ACA or any other recent legislation affected your business positively or negatively?
I think negatively. I think
it's negative for everybody.
Yeah.
No, I just wanted to be honest.
Yeah.
It was positive, I want to hear it.
I don't think, we're actually fighting for, so currently HSA cannot be used for DPC. So we are trying to get that bill passed. So it's been very challenging.
You may have actually answered my question, but I wasn't sure. When the Obamacare mandate was in place, how did that work for your patients?
I started in the middle of it, so I don't think it had a big impact. I think that was part of the reason why a lot of people felt frustrated. So I think that's when DPC really boomed because doctors, especially primary care doctors, were just really squeezed. So there's definitely a negative impact.
Sorry, Tom. Too short.
My motive for asking this is I'm going to bring this up to my doctor. See her next time. Not that I'm going to be a big advocate, I just want to mention it.
Mike, close to your mouth.
I'm worried about, in order to succeed as a doctor, you have to also succeed as a business. And I could see another doctor without your experience being worried about being inundated with requests or having large expenses that were unexpected, and since there's no insurance. So I want to know what you would say to a concern like that from another doctor?
I mean, exactly, are you talking about business expenses or patient care expenses?
No, I'm not a doctor, I'm just anticipating that a doctor who is thinking about this is going to be worried about the business aspect of it. How do you succeed?
Yeah, it is. I think the business actually is a very lean startup. You can, I mean, there are some templates out there. You can start pretty lean. And I know a lot of DPC doctors that have started basically just by house calls and then gotten their own space. So it's really about building it up, and if you really believe in this form of medicine and you have a passion, then it's possible. I mean, I never took a loan from the bank because banks would not give a DPC doctor a loan, because I did go to a bank and they asked me to sign up with, I think, 5 insurances before they would give me a loan. Start a practice.
Okay, so we got Trey, and then we'll work this out.
Kind of building on that, how would you say your own financial generalist? Are you better off or worse off than when you were dealing with, hundreds and hundreds of patients a week, as opposed to how many things do you average now roughly and having to come into the office?
So now I would say financially, I'm nowhere close to where I was as an insurance doctor. It's going to take me another 2 years to maybe get 50% of what I made before. But I think as from personal life and balance and as a mom, I am so happy for it. I would never go back.
So I have kind of a question, because a lot of doctors are tied up with insurance companies, paperwork, things of that nature. There's also a lot of pressure on certain types of tests, certain types of things. How has the not having to have that thing umbrella over you affected the way that you practice medicine?
It's nice because I don't have to document just because of the insurance. So a lot of times when you go to a doctor, a lot of things they're doing because insurance is mandating that we document all that to get reimbursed. So for example, your BMI. I mean, your doctor may or may not use that information for that visit, but it has to go on the note. Yes, $65. And usually the range for kids is like $35. Yeah. Per person.
And how much education do you have with the functional medicine part?
I have completed my entire course card with functional medicine, and I'm taking the board exam in November.
How much coursework was it?
18 months. So 7 months.
What does that include? Does that include diet?
No, it basically has different modules, focusing on immune system, mitochondria energy, biotransformation, elimination, detox systems, hormones, transport, that's cardiovascular, lymphatic system, simulation, that's the biggest is in functional medicine, that is the key. And I do all kinds of functional testing using labs, such as a lot of doctors do that. 2 other labs, and I do use supplements in some cases.
I was very interested. I mean, we hear a lot about how the European. I'm working in kind of health economics, so we hear a lot about how the European system is cheaper. But what's interesting to me was to see how similar, because I lived in Europe for 9 years, and the similarity between what you're describing and what I experienced, right? When I would see a doctor in France, for example, it was her, and there was no receptionist, there was no billing person, there was no lab person, there was nothing wrong with it. I mean, she would do everything. And what you're describing is exactly what is wanted over there as lowering costs. So, I mean, it's actually the same solution in some ways, which is amazing.
Yeah, well, I don't know, I practice, well, I went to school in Hungary, and I have some experience, I lived in India, so I mean, that's how it was in those countries. You have, sort of Medicaid, Medicare types programs in India, but you also have private care that's available, and you can opt to, choose which one.
But my question was about the EMR and the government reporting, so I think you clarified it.
Yeah, I don't participate in any quality features at all.
Okay. So you don't
I think
have
my
to do
quality
the reporting.
certifications, and I think that's one of the things that a lot of government agencies, unfortunately, they do not like about DPC. We're kind of bypassing them and going straight to the patient.
Well, as somebody who's analyzed millions of records of EMR data, I've yet to find much that was on it.
Right, I mean, that's the whole thing, like you can go through pages and pages of same information without changing patient outcome.
So with the model, do you give vacation? So you give vacation, you get a time away from patients.
I do, yeah. Yeah, and in that time, like I said, I'm on call all the time.
You have another physician that covers you when you're away.
No. Well, I do have, I am kind of in talks as I grow my practice and become busier, then we're talking to other DPC doctors and see how we can cross cover.
Is there any role for nurse practitioners or physician assistants in the DPC model?
Yes, there is. Absolutely. They can either opt to have their own business under doctor. I think that now they're actually getting rid of the physician supervision.
Right.
Yeah.
Right.
So, yeah.
All right, so I'll hit you with two real quick questions. First, touch on one. Have you seen pressure, at least talk of insurance companies pushing back against DPC with additional regulation, additional rules, what have you? And then the other one, insurance doesn't guarantee health outcomes. It's been studied, that just having access to insurance doesn't improve health outcomes. And in this state, a big issue is rural areas and the level of poverty and how to get somebody like yourself into that rural area. So I guess the first question is, have you seen anything legislative working against direct primary care in this state? And what would be your suggestions for bringing people like yourself into more rural areas? Because you seem to have touched on it, talked about quality of life, and things are a little slower out in the country.
Yes, absolutely. I've worked in Fayetteville for 4 years, so I'm well aware of the fact that we lack good food in those areas. We have more fast foods in those areas with more poverty and probably more toxin exposure. That is unfortunately the reality. I don't know of any negative impacts on DPC that we brought on, or I'm not aware of them, other than the fact that the patients are not able to use their HSA to see a DPC doctor. And as far as expansion into rural area, I think sounds like a viable idea if there is a bigger, larger team. It may not be just one doctor, because I think the patient demands are just so high in those communities. You need probably a health coach, a nurse practitioner, and a doctor. Health coach would be someone who can do yoga, meditation.
Anybody else have any other questions? Would health coach be a licensed? I mean, what is the qualifications of a health coach? Because the big thing is licensing and regulations.
Going on in North Carolina, actually, you are not allowed to give nutrition advice unless you are RD. Or a health coach can work with a doctor in the coaches, they basically motivate their patients. It's like
What if the patient has a condition, an illness or whatever that requires multiple visits? How does that, or did you say, and I may just miss this, that every visit is a certain amount?
No, there's unlimited visits. So there's no extra cost to visit your doctor.
I'm not asking about the extra cost, but, so if you have a certain condition or illness that requires multiple visits, is one charge each time? That's
No.
No, it's just the flat charge, whatever the flat charge is.
All right, well, if there's no other questions. Dr. Grewal, thank you very much. I appreciate you coming out. We have, since you probably live local to me, you probably don't drink entire pots of coffee a day, but yeah, cup, and here you go, and you can now put it in the Great Libertarian. And if you happen to live in Congressional District 4 and you're unaffiliated, I'm reminding everyone, Barbara Howe, yes, just take that with you. There's an early voting site on the back and carry. We really appreciate it. We're big fans of anybody who is an innovator and trying something new and not necessarily playing by the rules. So thank you so much for coming out.
Thank you.